Hello everyone. Welcome to Drugs Notes YouTube channel. In this video we discuss about cord blood in details, so you like this video, subscribe our YouTube channel.
What is cord blood? Cord blood is the blood that remains in the placenta and umbilical cord after the birth of a baby. It is a rich source of stem cells, which have the ability to develop into different types of cells in the body and is therefore considered a valuable resource for medical treatments, particularly for blood and immune system disorders. Cord blood can be collected and stored for later use, either for the newborn or for public use as part of a cord blood bank. Why should I consider saving my baby's cord blood? There are several reasons why you may consider saving your baby's cord blood. Medical benefits. Cord blood contains stem cells that can be used to treat various medical conditions such as blood disorders, immune system disorders, and some types of cancers. Potential future use. Cord blood stem cells can be used for treatment at any time in the future if needed. Matching likelihood. Cord blood from your baby is a perfect match for the baby and has a higher likelihood of being a match for other family members compared to unrelated donor sources. Ease of collection. Cord blood is relatively easy to collect and does not pose any risk or harm to the mother or the baby during the birthing process.
It is important to note that while cord blood banking offers several potential benefits, not all medical conditions can be treated with cord blood stem cells, and additional treatments may be necessary. Before making a decision, it is recommended to consult with a doctor and weigh the costs and benefits of cord blood banking.
Is cord blood transplantation limited to the treatment of blood diseases?
Cord blood transplantation is an established treatment for many blood diseases.
In addition, research is underway to determine whether components of cord blood can treat other medical conditions such as stroke, diabetes, birth asphyxia, brain damage from lack of oxygen, cerebral palsy, and autism.
Cord blood therapies for these brain injuries and diseases are not standard medical practice, but are being evaluated in ongoing studies and may prove useful in the future. How is cord blood collected?
Cord blood is collected after the delivery of a baby, typically during the third stage of labor when the placenta is delivered. The collection process is simple, safe, and poses no risk or harm to the mother or the baby. Here is how it's done.
Preparation. The obstetrician will clean the area around the umbilical cord with antiseptic solution and clamp the cord into places to separate it from the placenta. Collection. Using a needle, the obstetrician will draw blood from the umbilical cord into a sterile collection bag. The entire process typically takes less than 10 minutes. Processing. The collected cord blood is then transported to a cord blood bank for processing and storage. The blood is tested for quality and quantity, and then processed to extract and preserve the stem cells.
It is important to note that cord blood collection must be arranged in advance, as it requires specific equipment and trained personnel. If you are interested in cord blood banking, you should discuss your options with your doctor and make arrangements with a cord blood bank before the delivery of your baby.